So today I'm reacting to wild animal attacks that ended badly. If you've ever wondered what happens to the human body when a person goes toe-to-toe with an apex predator, then you've come to the right place. I'd like to introduce you to Jeremy Evans, who recently appeared on a podcast entitled Curiousaholic, hosted by Heiko and Evan, to tell a brutal story which we will be drawing from in today's lesson.
So on the morning of August 24, 2017, I arrived at the spot where I parked my truck about 2:30 a.m. I was pretty excited, hopped out of the truck and threw the last little bit of gear in my pack, and I remember that morning seeing the bear spray in the back seat of my truck.
Sounds like a hike or a hunt. And we have bear spray in the back seat? All it takes is a couple buzzwords and I'm sure you can tell where this is freaking headed.
I was like, what's the chance of me seeing a bear? I ended up just tossing it in my backpack, and I was just way too excited to get on the trail.
Even though he took the bear spray with him, he didn't have time to use it when he later came face to face with a protective mama grizzly.
I saw a little brown thing run in front of me, and I knew right away what it was. It was a grizzly bear cub. I knew at that moment that I was reaching in my backpack to grab my bear spray. As I was doing that, I heard a branch break over my right shoulder, and I turned and looked, and there was Mama less than an arm's reach away. Right paw was stretched forward, stretching out. You can see the whites of her eyes, mouth slightly open. I didn't really have much time to react.
The fight or flight response is a very interesting phenomenon. Though Jeremy didn't have much time to consciously react, his nervous system and body are already on high alert. The amygdala is a structure in the brain linked to emotions and threat assessment, which can detect danger through rapid processing of sensory cues and identify potential threats before our conscious mind fully comprehends the situation. The amygdala then sends a signal to the hypothalamus, another brain region that is responsible for regulating various bodily functions, including the autonomic nervous system's sympathetic branch, which in turn increases heart rate and breathing, dilates pupils, and tenses the muscles. At this point, the adrenal glands release adrenaline into the bloodstream. So, when Jeremy goes to act, it'll be a fair fight. Or maybe not. At least, biologically speaking, Jeremy's body will be prepared to fight for its survival.
Grabbed the frame of my bicycle and just stepped aside and dropped the bike in front of her. Her head went through the frame of the bike and she had it on like a necklace.
When someone is forced to confront a threat, that is to say, fight but not flight, their brain's amygdala still registers the fear, but the decision to engage in combat redirects their attention and energy toward dealing with the threat directly. The release of adrenaline and other stress hormones can heighten alertness, sharpen focus, and increase pain tolerance in that moment.
Started smashing her in the face with my backpack, and she managed to pinch my right hand against the frame of the backpack. I got it away, and then I started really going hard, hitting her on the head.
Ideally, once you've demonstrated you're also a threat, a predator will decide you're not worth their trouble.
Kind of turned and started backing away, and I started backing up, and so I ran about 60 or so feet, jumped off into a spruce tree.
Unable to reach his bear spray or weapon, Jeremy took advantage of the stunned grizzly. But this bear was tenacious and the attack continued.
My right leg was hanging low and I was trying to pull it up. She stood on her hind legs and wrapped her paws around my right knee and just got it towards her mouth.
My biggest concern following this type of penetrating trauma to Jeremy's knee is functional impairment. With an attack already underway, his ability to move strikes me as very freaking important. The knee is a hinge joint, wherein the articulating bony surfaces, that is to say the ends of the femur and the tibia, don't form a very deep bony socket, causing it to rely on a complex structure of ligaments and tendons for stability and leaving it fairly susceptible to injury. A grizzly fang, measuring a couple of inches, has plenty of length to penetrate into or around a ligament and then tear it out as the animal pulls its head away. Furthermore, both the patellar tendon, which connects the patella or kneecap to the tibia, and the quadricep tendon, which connects the quadricep muscles to the patella, are located right beneath the skin, and if severed, would severely impair movement.
And I just remember looking down and seeing her wrap her teeth around my knee, and much to my surprise, it didn't really hurt at first. Crunched down and I hit the ground quite hard. And
adrenaline can have a mild analgesic or pain relieving effect by dampening pain signals in the brain and spinal cord. While the heightened arousal and alertness associated with the sympathetic response can increase the pain threshold, making it more difficult for pain signals to reach conscious awareness. And now that Jeremy is on the ground face to face with an apex predator, he'll have to rely on both of these functions to the nth degree.
She reached into the mouth, grabbed me on the left side in the love handle area, took a big chunk, lifted me up, threw me about 6 feet. I hit the ground quite hard.
The term love handle refers to the fatty deposits located on the sides of the waist and hips.
And don't forget about me, I'm back fat fatty!
Which could be a relatively good area to be bitten if the bite does not penetrate deeper into the subcutaneous tissue. That is to say, the fat itself. The kidneys are located in the upper retroperitoneal area, and their lower portions extend down to the level of the love handle, while parts of the small and large intestines extend outwards towards the side of our abdominal cavity. When these structures are punctured, food at various stages of digestion leaks into the abdomen and causes peritonitis, or an irritation of the lining tissue of the abdomen, and possibly even infection. Although, to be honest, I don't think infection is going to be Jeremy's problem.
And before I could take a breath, she was on top of me just instantly.
Pinned underneath a mother grizzly having already sustained wounds to the leg and the abdomen, Jeremy found himself literally in the jaws of the beast.
Her first bite caught me on the left side of the corner of the eye where it meets the nose, kind of in my tear duct area.
This attack just keeps getting worse.
She grabbed right there and crushed the whole left side of my face, kind of removing everything. You know, I'm just sitting there thinking, well, this sucks. Like,
sucks is an understatement. Judging by the positioning of the bear's jaw, as demonstrated by Jeremy, it looks as though her lower left fang may have caught underneath his mandible, which happens to be the largest and strongest bone in the human skull. Its strength is due to its dense bone structure and its role in supporting the muscles used for chewing, not getting chewed on. Unfortunately, in this case, it acts as an anchor, as the bear closes its jaws and drags its upper teeth downwards across the zygoma and the maxilla.
It's really hard to play dead when something's chewing on you. I rolled over and started punching her in the face, poking her in the nose, poking her eyeball, grabbing her ear.
Not everyone who gets into a fist fight with a bear survives to tell the tale. Thanks to Jeremy's detailed storytelling, we can dissect each moment that has medical significance. Granted, there are some parts I have omitted for the sake of a timely lesson, and I suggest you cue Jeremy's full interview up for later on.
Her back legs were digging into the right side of me, her claws digging in. That was really hurting, so I was trying to push her off.
From what I understand, grizzly claws are at least 2 inches long and can be more than 4 inches long. And they are used for digging roots and ground squirrels and for excavating dens. The flesh in the abdominal region sounds like no match, and I'm sure Jeremy received many lacerations in the exchange, which would all need to be cleaned thoroughly to prevent infection. Fast forward a few moments and Jeremy has done enough damage to scare the grizzly off.
Then I got up, dusted myself off, walked over to my pack, pulled out my phone, and then I took a picture to see what I look like.
This picture exists on the internet. I have seen it. And it will not be shown in today's lesson. Before you go looking for it, be warned. It is not for the faint of heart. Basically, much of the tissue, skin, fat, and even some of the muscle on the left side of Jeremy's face is torn downwards and hanging off. In the photo, he seems fairly composed, which stands as a testament to the potency of hormones released in fight or flight. On top of the adrenaline coursing in his blood, other hormones like endorphins, cortisol, norepinephrine, dopamine, and serotonin can also play a role in modifying pain perception. These chemicals, too, can affect how pain is experienced, helping to temporarily reduce its impact.
You know, I'm sitting there thinking, well, this sucks. You know, now I got to go home and get all this fixed up, and there goes my sheep hunt for this weekend. And
yeah, let it be known. When a bear has ripped your face off, urgent medical attention is prescribed. And so, Jeremy begins loading his rifle in preparation to defend himself on the journey back to his vehicle. Little did he know, the attack was not yet over.
As I was loading up the clip, I heard a sound of ice breaking, and my arms went numb and everything dropped. She had come back and grabbed me by the back of the head.
My first thought was that the sound of ice breaking was the sound of bones fracturing. But as you'll see, Jeremy's loss of function is fairly brief, and I think that a skull fracture caused by fangs now sinking into the brain case or the crushing of cervical vertebrae would have caused more complete loss of function. It's likely we're dealing with the teeth scraping against the bones at the back of the skull, the occipital and parietal bones above it, or the cervical vertebrae with some degree of compression on the neck. A sharp bite to the head could potentially lead to numbness and temporary limpness in the arms due to a traumatic brain injury or disruption of nerve pathways in the brain or in the neck. Sharp compression to the neck could disrupt the cervical vertebrae and the function of the spinal cord within it, or cause an acute inflammatory response in the tissues, here to similar effect.
And I just remember seeing her paws on either side of me, digging in the dirt, and she's just heaving and just dragging me by the back of the head.
Dragging Jeremy by either of the aforementioned locations would serve to worsen the damage.
You don't say!
Thankfully, his cervical vertebrae were not crushed in this portion of the attack, and his spinal cord remained intact. A lacerated or severed spinal cord at the base of the skull equates to wholesale permanent loss of function below the level of the injury. As we can see, that did not occur.
She reached over with one of her paws, caught me on the lower left side of the face, kind of the corner of the mouth, and she peeled all the skin off of the right side of my face.
Technically, you can live without skin attached to your face or any large part of the body for a short amount of time, perhaps several days even. As the largest organ in our body, the skin is tasked with the job of keeping moisture in and keeping bacterial infections out. With Jeremy's face being skinless, he will likely be susceptible to both dehydration and to infection. Not to mention the pain, as the nerve endings located in the second layer of skin, the dermis, will definitely be aggravated in this attack.
Removing everything on the side of my head all the way to the back.
With one
just
go,
one
she
pull,
grab-
just gone.
Just pull your flesh.
No matter how terrible an injury to the skin looks, if the skin flap is still attached to the wound and the flap is healthy, that is to say it has good blood flow and has not been damaged too severely, your doctor may be able to reattach it or close it to its original place.
Now you might take a couple bites, you might take a couple swipes, but using this tactic increases your chances of survival.
The fact that the grizzly created this wound with one swipe probably left more skin intact than several recurring blows would have.
And then she was chewing on the side of my head, and you just hear her crunching away like a dog just gnawing on the corner of my head. And
as you know, when a dog chews on a bone, not every bite will cause a fracture. Perhaps the bear created some chips and scratches here and there, but thanks to the resilience of the human skull and the skeleton, it sounds like much of Jeremy's bone structure remained intact. Luckily, since the skull and collarbone or clavicle are relatively close to the surface, the bear would be able to access them having only ripped through the skin.
5-6 seconds of her just chewing and pulling at my left side and neck all the way down my collarbone, just crunching away and ripping with her claws.
My main concern here, as she continues to root around in Jeremy's flesh, is the subclavian artery, which runs just below the clavicle, and the carotid artery extending up the side of the neck.
This totally sucks. Getting chewed on sucks.
Were either of these blood vessels severed, Jeremy would lose enough blood to enter hemorrhagic shock in about a minute. Seriously, the longer this attack goes on, the more miraculous Jeremy's survival actually becomes.
She took all the skin off my head from the base of my neck, peeled it all off and forward, down, pulling my jaw, the left side of my jaw off.
We're talking about a series of severe, but relatively superficial injuries in that his vital organs seem to have been largely avoided thus far in the attack. Worse yet, many of the associated nerve endings would still be intact, so whenever the adrenaline wears off, the pain would be incredible.
My left eye was hanging out of the socket with a piece of the skull hanging there. In order to look up, I'd had to pick it up and hold it in place or tilt my head back.
In comparison to the other bones in the skull, the eye socket or orbital is relatively weak, formed by the edges of the following 7 bones at a point where they all meet: the sphenoid, frontal, zygomatic, ethmoid, lacrimal, maxilla, and palatine. Thus, the orbital is born. Under normal circumstances, the orbital is one of several structures that anchor the eyeball in place. The extraocular muscles, connective tissue, and ligaments, even the blood vessels and optic nerve itself could assist in this function. Since the eye was still able to collect and transmit visual data to the brain, it's safe to say that most of these structures were still intact. Most likely, the zygomatic and maxillary bones, which form the lower portion of the orbital, have been crushed inwards to some degree, allowing the eyeball to roll forward and down without severing the nerves, blood vessels, or connective tissue.
My right eye was smashed into my skull. I didn't think I had a right eye at this point.
How does this continue to get any worse? So, directly behind the eye sits the optic nerve, along with soft tissues, the sphenoid bone, the cavernous sinus, and then the brain further back. The body doesn't waste a lot of space. By that I mean that each of these structures is pretty integral. Even the cavernous sinus, which sounds like it could have been crushed to allow the eye to sink inwards, contains important cranial nerves and blood vessels and assists in blood drainage from the brain. A fracture to the sphenoid bone would leave sharp edges of bone close to many important soft structures.
After she took another good swipe, she moved and I fell back and I was laying against the ground. I could just kind of make out an outline of something above me. Like I knew she was there.
With his vision and movement impaired, having sustained multiple life-threatening injuries, Jeremy is able to make one final attempt to fight back.
I reached up and found a nice fleshy part, grabbed with both hands, just twisted and pulled, and then I wrapped my legs around her neck and just hung on for dear life.
Now, I'm no expert in bear anatomy, but whatever Jeremy was pulling on sure sent a message.
She ran down the mountainside, just squealing like a pig down the way I came up, and
ultimately, Jeremy is able to load his firearm before the grizzly returns, and despite his impaired vision, defends himself successfully from any further attacks. But the fight isn't over yet, as you can imagine.
that everything was so blurry. My right eye, I didn't think it was there. So all the skin off my head was peeled off. I couldn't stand up. All the ligaments were severed in my right knee.
Not to mention the various other wounds he surely suffered in the attack. Now, he must immediately seek medical attention before his fight or flight adrenaline cocktail wears off completely. Exhaustion sets in, and he is confronted with the brunt of the pain. To lose consciousness at a moment like this would likely mean death, and Jeremy's next couple actions were critical to his survival.
I was in quite a bit of pain. I knew relatively where I was on the hill, and I crawled down and found the trail right away, and I crawled down the trail and managed to find my pack.
Crawling through the wilderness with so many open wounds, infection becomes a distinct possibility. Tetanus, which is an infection caused by exposure to the Clostridium tetani bacteria, which is prevalent in dirt and soil, is a distinct possibility here. Though at this point, with many more emergent injuries, I'm sure Jeremy wasn't thinking about infection.
I grabbed a long sleeve shirt on my backpack and I put it on upside down with the neck part on my head. I opened up the body of the shirt and I layered all the pieces of my face in there.
Pieces of his face that he'd found while searching for his pack. You know, flesh, an ear here, a cheek there, that the bear had ripped off in the attack. Reattaching simple tissue without ligaments, tendons, and bones is relatively simple compared to the reimplantation of a body part with its more complicated structures, like, say, a whole hand. After cleaning the wound and removing dead tissue, sutures will anchor the flesh in place, while the innate healing capabilities of the body take care of the rest. Poof.
Folded it down, tied the sleeves underneath my chin real tight to hold my jaw because my jaw was flopping down, and I tied 2 knots in the back to hold my head straight.
I must say, Jeremy's instincts are excellent. Typically, the window for attempting reattachment surgery of severed flesh is measured in hours. And although he has nothing cold or sterile to help preserve the pieces of flesh wrapped in his shirt, they still could be viable if Jeremy can act fast. By tying the shirt around his head, he's done what he can to limit blood loss in the open wounds located there, as well as keep the dislocated mandible in place.
Grabbed a sweatshirt, basically threw it over my shoulders to protect me from the sun. I needed to take a small step with my left foot and then slide my right foot forward.
Meanwhile, his sweatshirt will help shield his body from further dehydration, given how much blood he already would have lost. Given the lengthy hike that occurs next, I'm fairly confident in saying that no major arteries were torn in the attack. Jeremy walked with only one functional leg 12 kilometers back to his truck. He then managed to drive his truck out of the bush to find help at a nearby campsite. It would be hours before he received the medical attention that he needed. This man is a freaking trooper. He stands as a testament to resilience of the human body, mind, and spirit. If you liked the video, be sure to subscribe and give it a thumbs up. And if you didn't, be sure to let me know why in the comments section down below. And don't forget to subscribe to my online gym, Hubert 2.0 Fitness, for free right here on YouTube, where we help you to move better and prevent injury. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.